It's 9:15 a.m. and I'll now call the meeting to order. I'll conduct a roll call to make sure all of the following members are present. Dr. Angelo Akista.
Here.
Dr. Maida Galvez.
Here.
Dr. Sydney Hankerson.
Here.
Dr. Mitch Katz.
Here.
Dr. Simona Kwan.
Here.
And Dr. Michael Lindsay.
Here.
Great, thank you, everybody. I'm going to do some super brief updates since it feels appropriate for the time that we're in, and then we'll get into the rest of the agenda for the meeting today. So just a few brief updates from us at the agency on the next slide. So as everyone I know has been following very closely, the longest federal government shutdown in history just ended late last night with a vote and signature by the president. Congress got it done. We are happy that the shutdown has ended after 43 days. Many of us, I think, were experiencing the challenges of inconsistent messages and plans around SNAP benefits, amongst many other things. And a part of the budget deal, all of the key aspects are listed on the right, including the fact that the RIFs that occurred during the shutdown will be reversed, and a number of other areas that are relevant for public health and healthcare as well. Hot off the presses, that has happened. On the next slide, I did want to just also share a white paper that we recently released in the New York City Health Department. We are putting forward this just concept paper really around the power and impact of community health workers, both as a health equity intervention and a workforce intervention. This builds on the work that we did in partnership with H&H and many other community-based organization partners around the public health core during the height of the pandemic. We project that there could be billions of dollars in healthcare utilization savings were we to expand community health workers across the city to reach 1.5 million New Yorkers with 10,000 community health workers. And then we've done some modeling in partnership with NYU around what a community health worker intervention would do in terms of life expectancy. And everyone's familiar with our Healthy NYC campaign to extend life expectancy to the longest it's ever been in the city. Our modeling with NYU suggests that there would be a gain of up to 0.33 mean life years in the neighborhoods in New York City that have the lowest life expectancy. So again, a big opportunity, and look forward to discussing this white paper further with our partners. On the next slide, we also recently released an analysis that updates a prior analysis that the health department did about 10 or 15 years ago that looked at the $15 minimum wage at the time. We updated the analysis for a $30 minimum wage and showed that the expected premature death rate would decrease significantly were that to happen. And it would prevent as much as 1,400 premature deaths every year were New York City to adopt a $30 minimum wage You can find more information about this on our environmental health data portal and specifics about how we did the model and specifics about both a $20 and $30 version of a minimum wage increase. So check it out.
But it was conducted when, where, how, who?
Here at the health department with our economists and analysts, and we updated the methodology from the peer-reviewed publication from about 15 years ago on the $15, and we are working to get it out there in a peer-reviewed publication. But right now it's accessible on our data portal, and you can see all the methodology, you can see all the data we used. It is very clear and very well done.
Compelling if it's true.
Yeah, right, exactly. We agree. And then on the next slide, briefly, we also just recently launched our first ever neighborhood stress-free zone. I think many of you are familiar with the fact that one of our Healthy NYC goals is to reduce Black maternal mortality by 10% by 2030. This stress-free zone opened in Brownsville a couple of months ago, specifically because Brownsville has the highest pregnancy-associated mortality in the whole entire city. We did this in partnership with the Perinatal Network and Public Health Solutions, building on the 1115 waiver social care network infrastructure, and also building on the recommendations of our New York City Maternal Mortality Review Committee. So another big milestone for us that has just happened recently. And then the other big update on the next slide is that we also recently released our added sugars warning rule implementation plan. So New York City chain restaurants, which is defined as restaurants with 15 or more locations, now must include on the menus next to food or drinks that have 50 grams or more of added sugar, this icon that looks kind of imposing and scary, or maybe like salt or sugar. But you should start seeing this beginning in January when compliance begins. And we're really happy to partner with lots of organizations across the city and our chronic disease team to make this happen. So warning for sugar for all New Yorkers for sure. And then just a brief Healthy NYC update. On November 20th, next Thursday, we'll be celebrating our second annual symposium and the 2-year milestone of the launch of Healthy NYC. We'll be sharing our updated provisional life expectancy data for 2024. And I'm not going to spoil it and tell you where we are, but it's good news. And I hope that many of you will be able to attend. It is open to the public and it's it'll be a very exciting milestone for the city. And then finally, as a reminder, we are coming to the end of our 220-year-long birthday celebration. And in December, on December 3rd, we'll be having a former female health commissioner panel to kind of close out the year of celebration, and hope that many of you will be able to attend that as well. It's been 220 long but very productive years of the New York City Health Department. So with that, let's get into the rest of the agenda. Oh, sorry, I should pause. Are there any questions about those updates?
Yes.
Please.
So in terms of listing the caloric contents and
Yeah.
the health problems that we have with sugar, not all sugars are created equal.
True.
And they're differentiated based on glycemic index, which very few people know about.
Mhm.
How do we take advantage of that?
That's a great question. So this is specifically for added sugars, which is one of the kinds of sugars that we're most concerned about and drives weight gain, diabetes, chronic diseases, et cetera. Now I don't have all the specifics. Actually, we could follow up with you on kind of what current regs are just about listing calorie counts and things like that. I don't have that top of mind, or maybe Corinne knows. Yes.
I can. Because, good morning, everybody. Corinne Schiff. I'm the Deputy Commissioner for Environmental Health, and we work with our chronic disease unit on policy proposals. And then it's my division, our Office of Food Safety, that enforces these in our chain restaurants. So calorie labeling began in 2006, maybe something like that, initiative of the Board of Health. And chain restaurants are required to post calories. If you visit chain restaurants, you should be seeing that. If you don't see it, call 311. That calorie information. This added sugar warning rule was actually a city council initiative, and it applies to packaged goods only that have the nutrition facts label. And that's because so far the federal government has not required disclosure of added sugar. So what we can know is what is on the nutrition facts label. So we are hoping that the federal government at some point expands that information for the public, and we'll be able to treat added sugar more like we treat sodium. The sodium warning was another initiative of the Board of Health that is also at chain restaurants. So restaurants are starting to post this. That's our sugar. It matches. It's a sibling to our sodium warning that looks like a little salt shaker. And so there'll also be evaluation to see how it affects New Yorkers' purchasing decisions.
Yeah. So I don't know how much time you want to spend on this particular topic, but I do have something to say about it. And maybe it would be additive to some of the things that we tend to accomplish here.
Mhm.
So we can do this offline, or I can just briefly say a couple of things now, whatever you think.
I think if you're okay doing offline,
Sure.
is that okay?
Absolutely.
But would love to talk more. Yeah, we are very, very clear in our need to focus on chronic disease prevention in New York City. So to talk more about some ideas you have, and the whole board, of course. Any other questions on the updates? Good. Okay. All right. So on the agenda, I'm going to ask us to move to approve the minutes from the August 13th meeting. Are there any corrections by board members to those minutes? Okay. All right. Hearing no corrections from the August 13th minutes, could I have a motion to approve those minutes?
So moved.
Thank you, Dr. Katz. Could I have a second? Dr. Lindsay, thank you. And now I'll take a vote. Dr. Akista,
4.
Great. Dr. Galvez? Dr. Hankerson? Dr. Kwan?
Approve.
Okay, great. So the motion passes to approve the minutes and adopt the minutes from the August 13th meeting. Thank you. And then next up, we're going to move into the first item on the agenda, which is a proposed notice of adoption amending Article 47, childcare programs and family shelter-based drop-off child supervision programs of the New York City Health Code. Our presenters are Corinne Schiff, Deputy Commissioner of Environmental Health, and Renee Noel, Assistant Commissioner of the Bureau of Child Care. So I'll pass it to you for your presentation.
Thank you, Commissioner. Good morning again, everyone. Corinne Schiff, Deputy Commissioner for Environmental Health, and I'm here with Assistant Commissioner Renee Noel of our Bureau of Child Care. By way of background and a refresher from our meeting in August, Health Code Article 47 sets requirements for child care centers in New York City. These are programs serving children under age 6 in freestanding commercial spaces, and we've got about 2,200 of them in the city. The article sets requirements for a range of health and safety protections, and those include, as relevant for our discussion today, qualifications, the ratio of children to staff in the classroom. As you know, and we discussed in August, there's a nationwide shortage of childcare professionals, and New York City, like localities across the country, faces shortage of childcare professionals, and that means that some childcare providers may have to reduce enrollment, suspend operation, or delay opening. And this in turn may mean for parents or guardians that they are unable to find regulated childcare. And so we're proposing to add flexibility for childcare providers regarding staffing without compromising child safety. You may remember that our first category of staffing flexibility addresses the education director. This is the leader of the childcare program. We want to specify the hours when the education director must be on site. The rule has been that the education director has to be there whenever there's at least one child there. We know that these programs are open sometimes 10, 12 hours a day, and so it's not reasonable to ask a person to be on the job for that long. So we want to amend that to say that the education director must be on site during core hours. That's a new term that would be defined, and that is at least 8 hours a day.
What's the qualification of the education director?
Yeah, the qualifications is New York State certification and experience, 2 years experience in teaching that age group.
So no degree required?
Well, in order to get the New York State certification, you have to have a degree, a master's degree in early childhood education. So it's understood.
Next, we would expand who could cover for the education director outside of those 8 hours or when the education director is absent, vacation or otherwise. Right now, it is only a group teacher who has that New York State certification that the Assistant Commissioner just described. What we are proposing is that we would expand who can cover to a group teacher who doesn't have certification but has significant child care program experience. Next, we want to make sure that there is constant coverage for the education director when that person is not on site. Currently, the provider doesn't need to name in advance who would cover for the education director, and that can cause gaps in coverage and confusion about who's the leader on site. So the new rule would be that the provider has to list the education director designee in their safety plan. Safety plan is something that's already required for childcare providers to have. And then finally, we want to make a clear time frame for the coverage by the education director designee. Right now, we don't specify that. And so we would set that rule to be for up to 60 days. Next, we want to add flexibility for group teachers. The group teacher is the leader in the classroom. The current rule is that the group teacher in the 2-year-old classroom has to meet preschool qualifications. We want to align those qualifications with the traditional preschool designation to begin in the 3-year-old classroom. So the 2-year-old classroom teacher could have the qualifications for the traditional younger than preschool age children. And then next, to address meeting ratios when the group teacher is absent, the rule is that a teaching assistant and teacher's aide can be in the classroom to ensure that the ratio of staff to children continues to be met, but that is limited to 3 days, and we would allow this coverage for 5 days. So you, the board approved our proposal on August 13th, thank you, August 13th, 2025. We held a public hearing on the 22nd of September. 10 people testified and we received 39 written comments. The comments, we received many positive comments and appreciation for the changes. I know that at our last meeting, board member Gail Naowith had asked us to come back and let you know just generally how it was being received. I know Ms. Naowith's not able to be here today, but we did want to let you know that generally we got many appreciative comments. We received some unrelated suggestions, and those are things we will continue to review for potential further amendments to come back to you. We got questions from commenters and we'll address those in our guidance materials. And I will review now the 3 comments that directly responded to the proposed amendments. First, there were comments that we should allow the education director designee to serve for 90 days rather than 60 days. We're not proposing to make that change. As I noted and we discussed a little more in August, the education director is the program leader. They are hiring, they are training, they are monitoring curriculum and what's happening in the classroom. And it's really critical to timely fill that role. But we do note, and this is in our guidance, that for any particular childcare program that is having a specific issue, we always welcome providers to come to us and we can work with them on specific circumstances. Next, we received a comment that regarding the rule that the education director must be on site for 8 hours. There was a comment, what if the program is not open for 8 hours? We think we can clarify in guidance that if you're not open for 8 hours, your education director does not need to be on site for 8 hours. So we'll clarify that in guidance, but we don't think that needs to be in the rule. And then finally, there was a request, a comment that for the coverage for the group teacher, rather than limiting that to 5 days to meet those ratios, that we make that 10 days. Again, we don't want to make that change. Continuity of care is really critical especially for these young children. And the 5-day coverage doesn't mean that a group teacher can't take another 5-day break, depending on whatever that particular provider's annual leave practices are. But for this coverage rule, we propose that we really should keep that at 5 days. Those were the comments, and so we are now asking the board to adopt those amendments, and we're happy to take questions.
Thank you. Okay, so any questions from board members?
What is the enforcement mechanism, or how do you track that all of the, specifications are being adhered to?
So how we enforce is that we send out our inspectors and our ECECs, which are early childhood education consultants. So they go out and we do so yearly, right? And that's how we monitor and track if the programs are in compliance with Article 47.
How often is the safety plan reviewed?
The safety plan, according to the code, has to be reviewed by the program yearly, right, on an annual basis. However, we will review it on when we're renewing the permit. So the permit is good for 2 years. And so every 2 years, we will review it if there are extensive changes. If there aren't any substantial changes, we will just, allow it to go on for the next 2 years.
Can I ask one more question?
Sure.
So the chair designee has to be in the safety plan. Can they update that at any?
Oh, definitely. And in the code, it also requires them to notify us within 5 days if the ed director is terminated or leaves permanently. So.
Excuse my ignorance, but walk me through the process. There's a child that's been identified of having some difficulties. That child is identified by parents who consider that there's a problem, by the teachers, by the administration. How does the process work?
It sounds like these are developmental delays or is that what
Early
you're
intervention.
Which is usually picked up by the teachers.
Right, right. So I think we're gonna have to defer. Our program doesn't really address that. We do have other, an early intervention program at the health department, so maybe we can get back to you about some of the ways that we work with parents, providers, physicians to match children to early intervention services. And then there's also continuity protocols so that children leaving childcare, entering the DOE system, where those services are transferred, or at least that information follows that child. Our work at the Bureau of Child Care is really about the health and safety protocols that are in Article 47, which include qualifications for staff.
So I have a comment and a question. So first, as a father of a 7 and a 5-year-old, this is very personal to me. I think the comment is I applaud the health department's initiative to do this. I think this will give the childcare centers more flexibility and hopefully more leadership opportunities for staff. I guess the question is, because I'm aware of certain childcare centers that have had some very unfortunate issues. My children went to Bright Horizons, so
Yes.
specifically that question is about the educational requirements of like the ED.
Yes.
Are there any requirements for principals around trauma-informed care or other types of trainings? Because some of those things that I see it through the lens of trauma being passed on to kids. So just hear your
Right, that's interesting. Yes, in Article 47, it doesn't have requirements in terms of trauma informed. We do have training requirements of mental health. How to observe the child, the experience that the training that they receive as early childhood educators. And one of the reasons why we require that they have New York State certification in early childhood education. That's as the realm of what we cover in Article 47, but not trauma-informed care. But that's something.
And I would love your perspectives on that.
No, I love this point a lot.
Yeah,
I'm wondering if, in terms of continuing education,
Mhm.
certification that is, can we require that they receive some coursework in trauma-informed care?
So that would be, for their education requirements in terms of getting their certification and their training, their coursework in attending the colleges and universities. So that would be something greater than us, I believe, right?
Well, I think it's a very interesting point. Another follow-up I think we should do is there's a very long list of trainings that we require in Article 47. But I think we can take this as one of, I think it was point 3 comments that we will continue to look at and come back to you. So I think we can take this as a recommendation from the board. We hear from childcare providers that there are many, many training requirements.
Yes.
So, but also
Yes.
to your opening point, I
Say
think
the least.
Right.
many of us, we do this professionally, but we also have a personal experience. And so we come at this from both perspectives. So why don't we take that back and we also want to make sure that there are trainings that are free or low cost.
Right.
So we will take this
Yeah.
back and look into what the opportunities are to expand that training. Thank you.
And the reason is, I think as folks besides the ED are getting opportunities to lead and be in these leadership positions, I think those trainings would be even more.
Yes,
I
we do
agree.
think a lot about how can we encourage the pipeline, because we know that with the shortage of childcare professionals, we need to grow our own staff in New York City.
Mhm.
So that's a really helpful point. Thank you.
In addition, we also require the mandated reporter training. So they are all mandated reporters, and so they get some sort of how to identify abuse and maltreatment, but trauma.
Curiously, for the people that you identify with learning disabilities throughout the healthcare system, how many of those children approximately actually have mental health disabilities?
So we're not going to be able to answer that. So we'll have to follow up.
Because I think there's a role here for mental health participation.
Hmm.
I'm sure, and everyone here knows for sure, a good proportion of these children have mental health problems, which contribute to their mental health disabilities. I just merely mention it because that may be an arm that may or may not be added
Mhm.
as we're trying to help these children.
Mhm, mhm.
We'll follow up. Thank you.
Okay, any other final questions from board members?
One more question.
Sure.
Thank you for all your efforts to address childcare providers' challenges and struggles. I was wondering about that last bullet on the slide prior, the leave. Can you just talk us,
Sorry.
the 5 group teachers?
Oh, 5 days.
Yeah, can you tell us what that applies to and what the concerns were and how this?
Yes, so when the group teacher, who is the leader in the classroom, is going to be out, we need to make sure that there is coverage for child to staff ratio. The Article 47 sets how many children to adults can be in that room. So the code right now allows, I think I have this on another slide. Here we go. Allows the teaching assistant and teacher's aide to be in the classrooms. You can move an additional person, a teacher's assistant or teacher's aide, who does not meet the group teacher qualifications, but you have another adult in the room to meet the ratio. But the code limits that to 3 days. So we changed that to 5 days, gives you a whole week off.
Right.
And the comment was, can we have 10 days? And we think that 5 days is appropriate. It doesn't mean that that teacher can't take another week off. But that, that's the provider's own, these are private businesses, that's the provider's own annual leave policies. But for this rule, for the ratio, meeting the ratio of children to teachers in the classroom, we think extending from 3 days to 5 days is an appropriate change, gives more flexibility
Mhm.
to support group teachers, but also meets the needs of children for that continuity of care in the classroom. Does that, okay.
Okay, thank you for the questions and thank you for the presentation. We'll now vote on the proposed health code amendments. Could I have a motion to approve the proposed notice of adoption to amend Article 47 of the New York City Health Code?
So moved.
Thank you, Dr. Hankerson. And could I have a second, please?
So moved.
From Dr. Lindsay, thank you. I'll take a vote from each member. Dr. Akista?
Yes.
Dr. Galvez?
Yes.
Dr. Katz?
Yes.
Dr. Kwan?
Yes.
Great. So the motion passes with unanimous support from the Board of Health. Thank you again to our presenters.
Thank you.
On our last item on the agenda is the proposed resolution to amend Article 203 of the New York City Health Code regarding termination of pregnancy. Our presenter is Dr. Gretchen Van Wy, Chief Epidemiologist and Deputy Director for the Center for Population Health and Data Science and Assistant Commissioner for the Bureau of Vital Statistics. I'll pass it to you.
Good morning. Thank you. So as the commissioner mentioned, today I'm here to propose amendments to Article 203 of the Health Code. We've spoken about this article extensively in the past couple of years. Just as a recap, since 2022, the state and the city have adopted various protections of people seeking abortion care since Dobbs. In June of 2023, the board amended Article 203 to ensure the same strong level of protection for confidential information about terminations of pregnancy reported to the department. In December of 2023, approved abortion reporting form changes to update medical terminology and eliminate certain data points to further increase confidentiality protections. And in September of last year, the board amended Article 203 and Article 205 to make disposition of a product of Conceptus optional rather than mandatory. Since September of last year, the department has worked with external partners to better understand evolving concerns over the reporting of terminations of pregnancy. Providers and advocates have expressed continuing concerns about privacy issues, and administrative burdens in this current context, prompting us to really reevaluate the process and what we do. So the current status remains that all of the data that we have are stored in very secure electronic systems that meet stringent federal, state, and local city security requirements. But despite these protections, the changing political landscape poses a potential legal threat to the security of data and to abortion patients and providers. And of course, changes have also occurred recently at the New York State level. Specifically, New York State public health law was amended earlier this year in two significant ways. First, to adopt the broader term pregnancy loss to replace the term fetal death, and to require the reporting of induced terminations of pregnancy only when a disposition was requested by the pregnant person. Now, these differ from what we have in Article 203. So just to put a finer point on it, what happened at the state, the law changes at the state essentially make abortion reporting not required unless a disposition is required. So we propose to align Article 203 with state law on these important issues. We would like to clarify in the Health Code, Section 20301, that termination of pregnancy and spontaneous termination of pregnancy. We want to clarify those by adding the term pregnancy loss, so it's clear how these terms relate to what's in the state law. And we'd like to propose requiring the reporting of induced terminations of pregnancy only in instances where a disposition is requested by the pregnant person. I'd like to have any discussion that the board, like to answer any questions the board would have, and then close the vote.
Great, thank you, Dr. Van Wyn. Any questions from board members on this? Okay, all right. So seeing no questions, I'd like to request that we vote on the proposed health code amendments. Could I have a motion to approve the proposed resolution for amendments to Article 203 of the New York City Health Code for publication and comments?
Motion to approve.
Thank you, Dr. Gatlis. Could I have a second?
Second.
Thank you, Dr. Akista. I'm going to ask Dr. Hankerson
Approve.
and Dr. Katz,
Approve.
Dr. Kwan. Approve. And Dr. Lindsay.
Approve.
And I also vote to approve. So with a unanimous vote of 7 out of 7 board members, the motion carries. And thank you again, Dr. Van Wee, for your presentation. Any other questions from board members on anything else? Additional business anyone wants to bring at this time? Okay, so thank you for your service. The meeting is now adjourned.
Thank you.
Thank you.
Commissioner.
Yes, let's talk. Yeah, let's do it. I'm very curious. I wasn't sure if there was gonna be.
Now you're scaring me.
Second agenda item.